This is a converted shipping container, but it's a completely safe environment for me to work in as a healthcare worker. It has two emergency doors to get out of. I have a safe area to work in, to put all my PPE and my swabs, etc. I've got a sink to wash my hands. I've got heating in here. But the crucial thing, the main thing about this design is this fan up here. And if I was just going to switch it on, this is a strong fan which is drawing air away past me through here and directing any airflow into the direction of the patient. So it's a strong airflow, so if the patient does cough and splutter and sneeze, then as well as wearing the PPE and the mask that I'll be wearing, the positive pressure is keeping any virus particles away from my breathing zone. Right, so I think we also have to think about the pros and cons of a converted shipping container versus a drive-through arrangement. In the drive-through arrangement that I think is already being widely used, the patient is arriving and the inside of their car has probably got quite a load of coronavirus in it. If they're an infected patient, they then wind down the window, and potentially the healthcare worker is maybe going to have to try and lean in to get the swab, and the direction of airflow will be out with the car towards the healthcare worker. In this environment it's completely the opposite, so in other words the direction of airflow is from the fan at the back of the shipping container in the direction away past the healthcare worker in the direction of the patient. And the other advantage of this is that if the patient does have a fit of coughing, then you can close this hatch here to make it secure again. And I think the other advantage of this arrangement is that the patient is in a more private area. There's a space where they can put their belongings. They're not being seen by other people, and they're probably in a more controlled situation. If they do have a fit of coughing, and I think it's probably easier if you're standing and the patient's standing, you're both at the right height for being able to get that throat swab and get the nasal swab accurately. So the purpose of this facility would be to screen a whole community. It could be taken to a location to screen a whole community and do swab testing to get an accurate measure of transmission rates, etc.
Examining the coronavirus outbreak and the protection of the NHS staff from an industry outlook, I'm drawn to this document here, which is by the Health and Safety Executive. It's very, very clear that there's other control measures that can also be used in conjunction with PPE. So these control measures can be engineering controls and safety systems. Now we deploy these in industry regularly, and this is an example of such a system. This can be a great help to the NHS to move the contaminant away from their personnel, and it's as simple as that.